I heard that erectile dysfunction could decrease penis size. Could you please tell us about that?
Penis is a very interesting organ because think about the size varies a lot. There's no organ like that in our body. Actually, that's the reason why the augmentation surgery of the penis is very difficult, and the result is not that satisfied with the patients because our technology is not yet there to meet the changes of the size varies like that. But anyhow, maybe it is related to that kind of perspectives, but penis size decreases whenever it gets an injury, like a trauma or a Peyronie's disease, other type of all kind of injuries can shrink the size of the penis. So erectile dysfunction is also a form of injury which comes from the vessels. So it's a vascular injury happens to the penis. Blood flow decreases, and then kind of hypoxic damage is done to the penis, so their size can decrease. A good example could be a prostate cancer. When they have a prostate cancer, they need a prostate cancer radical prostatectomy can be done to cut the prostate out. 15 to 30% of the patient may suffer from the erectile dysfunction after the surgery. So their blood flow will suddenly decrease, right, to the penis. So in a year, about an inch of the size will shrink. An inch for height, maybe not a big deal, but an inch for down there is a huge thing. So patient suffers from that. They cannot notice their changes a lot. So the other example could be a comparable example could be a diabetic patients who has a erectile dysfunction. So diabetic patients tend to have a long-term damage very slowly. Physical injuries are done to the penis, so their size shrinks on the very slowly, but very slowly. So it's very comparable. Examples I'll say. So yeah, whatever injury the penis has, the size can decrease.
But just a question, why is penis size so important for men?
I would say, why is the breast size so important for women? So when it comes to genitalia, it's not just about the function. A woman's breast is not for just breastfeeding the baby, right? It's also one of the genital organs. Genital organs almost always has a very deeply related our own self-esteem, our own self-image. That's why if, let's say, woman has 3 nipples, will they be, treated for that or not? They will definitely get a treatment because it's a genital organ. You have a mole in here, you don't get a treatment almost all the time. But if you have a mole or something similar in your around nipple, you will almost always get treatment. Why? Because it's your genitalia. So genital organ has always deeply related with our self-image. And for men, our penile size also deeply related with their own manhood as well. So what I stress is that I'm not saying they need a huge, this size of penis, no. But at least it is a decent way to respect them by restore them what they had before. I'm not saying that we have to, grow it, but they need to get it at least what they had before. Just like a breast cancer surgery. So when women had a breast cancer and then they had a radical mastectomy, cutting their breast, all the breast tissues out, they need a breast reconstruction. But when getting a reconstruction, wouldn't they want the same size of what they had before, rather than smaller or bigger than that? So they want the same size. They want to restore what they had. It's the same concept.
I'd heard that the inflatable implant actually decreases the length after surgery. Is that still the case?
That's how I was trained. When I was getting the training in the US, I traveled around meeting not just one surgeon, but one of the biggest implanters in the US. So I traveled 2/3 of the US to see the so-called king of the state, king of the South, king of the North, king of the Midwest or something like that. And all of them taught me, all of them was consulting the patient that they will have a decreased size after the surgery. So I thought that, it's a textbook way. You can say that your penis will shrink after the surgery. After I came back to Korea and started my own practice, I finally understood there's something missing. This surgery, why do the patient getting this surgery? They are not just getting it for the function. They are not just getting it for the sex. They were trying to restore their manhood. In terms of that, penile size also should be accounted when doing the surgery. So I had to find a way how to restore the size And thanks to Dr. Wilson and Robert Valenzuela in New York, they taught me the subcoronal approach. After I converted to the subcoronal approach and applying the other methods I learned before elsewhere around the world, I was able to restore the size after the surgery. Now I tell my patients, I have about 700 cases with me, which shows that their size can restore after surgery. So I can safely say that penile implantable penile prosthesis surgery can restore their lost size. I don't know whether it's a complete or not because I can tell. I can't see the patient 10 years ago, right? But still, what the patient told me was that they restored the size after 6 months to 2 years.
So can size be restored with erectile dysfunction surgery?
Yes, it can. So maybe there may be a change of the degrees, like maybe not 100% or 80%, I don't know, or 110%, we do not know, because we surgeons can never see the patient in ahead of the disease. So I do not know their full size, right? But still, what we can achieve is that we can restore as much as you can. There's only one way we can achieve it, is currently in my eyes. The safe way is with the inflatable penile prosthesis surgery.